Hi, I'm Caroline from EmpowerIn, and I've partnered with NurseJournal.org to cover the topic of being a nurse outside of the normal bedside nursing. 15 fantastic options. We really hope this video helps you out a lot. If it does, please do us a favor and give the video a thumbs up. Alright guys, without any further ado, let's get right into the video. Earning a nursing degree opens you up to a world of tremendous opportunity. The opportunity for advancements are incredible. The longer you go to school, the more letters you put behind your name in the form of credentials, and the greater your earning potential. Almost everyone needs a side hustle, and your nursing degree sets you up for anything you can imagine. So let's explore some awesome options. Want to work PRN in a similar unit in a different hospital? Go ahead. Think you might want to get some extra hours in at a pain clinic or surgery center? Do it. Perhaps you would like to exercise your creative side while using your nursing knowledge and expertise. Try your hand at being a freelance nurse writer. If you can imagine how you'd like to use your nursing degree to advance your career, expand your horizons, or make some extra cash, you can make it happen. Listen on and learn about the exciting and different clinical nursing specialties, non-clinical jobs, and nursing positions that can take you out of the hospital. Let's first explore some non-traditional clinical opportunities. If you're interested in labor and delivery and would like to help moms through the birthing process, you should consider a career as a nurse midwife. Nurse midwives are specially trained in pregnancy, birth, and caring for mom and baby immediately after birth. They have their master's in science of nursing, specializing in midwifery. Birthing centers and hospitals are primary places of employment for the nurse midwife, where they care for mothers during low-risk pregnancies and deliveries. Occupational health nurses are employed in nearly every large company across the country. They ensure necessary vaccinations and tests are completed to provide care to employees as necessary. Workplace injuries and illnesses can first be treated by the occupational health nurse, who determines if further care is necessary. A mental health nurse can work in a psychiatric hospital or units, outpatient facilities, and provide mental health care to patients in their homes. They assess the mental health needs of the patient in collaboration with the medical team to determine the best care for the patient's mental health needs. Now let's explore some non-clinical nursing jobs. This could be for nurses seeking a change, even options for ex-nurses. Nurse health coaches help their clients live healthy lives by teaching them about healthy choices. They work frequently with chronic illness sufferers, such as those with diabetes and heart disease, to improve their health and wellness. Nurse life care planners work with patients who have suffered significant illness to plan their life and create a roadmap for health. They advocate for the patient and determine the patient's future needs, including the associated cost. Nurse life care planners can be self-employed and consult for lawyers, insurance companies, and the patients themselves. The nurse navigator's primary role is to coordinate care and help the patient achieve their healthcare goals. The goal of the American College of Surgeons is to have a nurse navigator in every accredited cancer center to help remove barriers to care for patients. They advocate for their patients, educate them on their disease and treatment, and assist with the paperwork associated with the complex medical care. Academic nurse writers can fulfill many roles. They can author nursing textbooks, assist with the creation of ancillary material, and write nursing journal articles. Research writing is within the purview of the academic nurse writer. Legal nurse consultants. Legal nurse consultants use their nursing expertise to evaluate and give options on legal care, such as medical malpractice and personal injury lawsuits. They may be self-employed or work with law offices, hospitals, insurance agencies, and many others. A law degree is not required. However, certificate programs are offered to formally train legal nurse consultants. Nurse case managers coordinate care for patients with complex healthcare needs. They collaborate with the medical team to ensure the patient has the necessary services and resources in place prior to discharge from the hospital. Nurse educators support staff nurses in hospitals by ensuring they are properly educated on how to care for their specific patient population. They are generally tasked with overseeing the nurse's orientation to the hospital and unit. Additionally, they ensure nurses keep up the necessary skills and knowledge to safely care for their patient. Forensic nurse consultants collect evidence from victims of violence and sexual assault to aid the police in catching the predator. This is all done while providing care to the patient regarding the trauma they have experienced. Forensic nurses may be called to give expert testimony in court. Non-hospital opportunities. Concierge nurses help patients navigate the confusing healthcare world. They assist with the search for appropriate specialists based on the patient's needs. They make sure the patient gets all of his or her questions answered and help organize records. Coordination of outpatient care is the primary goal of the concierge nurse. Public health nurses care for entire communities. They work to meet the health needs of special populations within their community. This could include people from other countries, individuals with HIV, or people with mental health needs. Corporate nursing jobs provide an array of opportunities that is growing every day. These jobs are sometimes difficult to find. However, as the world is changing, they are becoming more popular. They can include content curators, managers, insurance verification adjusters, NCLEX prep instructors, and more. Hospice nurses provide end-of-life care to terminally ill patients. They are tasked with ensuring adequate pain control, helping families grieve, and maintain the patient's dignity. Hospice nurses generally go to patients' homes, which can allow patients to remain at home where they are comfortable. Dialysis nurses may work in the hospital or in a dialysis clinic. They assess dialysis ports and catheters to provide dialysis to patients in end-stage renal failure. Dialysis nurses are employed both in the hospital and outpatient clinics. So dialysis nurses can be an excellent option for someone who loves working with patients but isn't interested in working in the hospital. Thanks so much for watching, guys. Make sure you visit nursejournal.org, a popular social community for nurses worldwide. One of their best features is this page right here, which houses over $200,000 worth of scholarship opportunities. This is just the start of what they have to offer. Visit nursejournal.org right away.